I'm Cindy Hall, President of the Women's Congressional Policy Institute, WCPI. Welcome to this afternoon's event celebrating the 30th anniversary of the National Institutes of Health Office of Research on Women's Health, ORWH. As most of you know, WCPI is a nonpartisan, nonprofit public policy organization whose mission is to bring together a community of bipartisan women policymakers and trusted partners to advance issues of importance to women, develop the next generation of women leaders, and foster a more effective and representative democracy. We work closely with the members and staff of the Bipartisan Congressional Caucus for Women's Issues. I would like to thank our congressional briefing co-sponsors, some of whom will be speaking momentarily. Congresswomen Brenda Lawrence and Debbie Lesko, co-chairs of the Women's Caucus, and Congresswomen Madeleine Dean and Jennifer Gonzalez-Colon, vice chairs of the Women's Caucus. We are very privileged to have the opportunity to sponsor this important celebration and to host such an esteemed panel. Dr. Janine Clayton, Associate Director for Research on Women's Health and Director of ORWH, and Dr. Vivian Pinn, the first full-time Director of ORWH, who served in that capacity until her retirement in 2011. We all are grateful for their many years of leadership and contributions to women's health. Our thanks to the many and current and past ORWH employees attending today for their many contributions to women's health. I would like to acknowledge several other attendees. Dr. Kavita Vasisht, Associate Commissioner for Women's Health, Food and Drug Administration, FDA, and Marcia Henderson, Susan Wood, Audrey Shepard, and Ruth Merkatz, each of whom are former directors of the FDA Office of Women's Health. Doctors Nancy Lee and Wanda Jones, both former Deputy Assistant Secretaries of Health, Women's Health, and Directors of the Office on Women's Health at the Department of Health and Human Services. Congresswoman Debbie Dingell, Lucille RoybalColeman, Eddie Bernice Johnson, Lois Frankel, and Susan Davis are attending today or will join us shortly, as are former Congresswomen Mary Rose Okar, Marjorie Margolis, and Connie Morella. Each of them has made women's health a priority and long supported ORWH. We will be including statements later in the program from former Congresswoman Pat Schroeder and Senator Olympia Snowe, who co-chaired the Women's Caucus for more than a decade and helped lead the effort to establish ORWH and were longtime champions of women's health. And former Senator Barbara Mikulski, chair of the Senate Appropriations Committee, and former Congresswoman Connie Morella, who co-chaired the Women's Caucus in the 104th Congress, who were instrumental in the establishment of ORWH. They requested the critical meeting in September 1990, which included every institute director at NIH, to discuss the omission of women in clinical trials and research, and at which then acting director, Dr. William Robb, announced the establishment of ORWH. Dr. Ruth Kirstein, the first woman to direct an NIH institute, and who later served as deputy director and acting director of NIH, played a critical role. We are so pleased to welcome Andrea Camp, former Congresswoman Pat Schroeder's longtime legislative director and press secretary, and Robin Lipner, Senator Mikulski's legislative director. I was Connie Morella's legislative director then and joined Andrea and Robin in witnessing history being made at that meeting. A few years later, Congress established the office and statute as part of the 1993 NIH Revitalization Act with the help of a number of senators and members, including Women's Caucus members and former Congressmen Henry Waxman and John Dingell. And many others have continued to work to ensure funding for ORWH over the past 30 years, including House Appropriations Committee Chair Nita Lowey and Appropriations Labor HHS Education Subcommittee Chair Rosa DeLauro, and Congresswoman Debbie Dingell, who served on the first NIH Advisory Committee on Research on Women's Health. More recently, Senator Patty Murray, ranking member of the Committee on Health Education, Labor and Pensions, and Maryland Senators Chris Van Hollen, well represented by senior staff today, and Ben Cardin, also have worked to preserve ORWH. I also would be remiss if I did not mention late Congresswoman Louise Slaughter, who also was an early and longtime champion. Lastly, there are a number of advocates for women's health in the audience. Many of you were instrumental in the establishment of ORWH, have partnered with it, or have supported its work over the years. I would like to specifically acknowledge the Society for Women's Health Research, which was established 30 years ago in response to the need for greater advocacy for women's health research. We welcome its new CEO, Katie Schubert, and acknowledge the work of founder Dr. Florence Hazeltine, and founding and longtime CEO, Phyllis Greenberger, and the Society's former Vice President for Public Policy, Martha Nolan. I also want to acknowledge Cindy Pearson, longtime Executive Director of the National Women's Health Network, who worked to make ORWH a reality, and Diana Zuckerman, longtime President of the National Center for Health Research. And the many others attending this event, too many to name individually, who have partnered with or worked hard over many years to ensure the continued funding of ORWH. To each of you, thank you. We will be live tweeting during this event and encourage you and others to do so as well, using the hashtags WCPI Health and ORWH turns 30. Dr. Clayton serves as Associate Director for Research on Women's Health and Director of the Office of Research on Women's Health at the National Institutes of Health. Since assuming this role in 2012, Dr. Clayton has strengthened NIH support for research on diseases, disorders, and conditions that affect women. She is the architect of the NIH policy requiring scientists to consider sex as a biological variable across the research spectrum, a part of NIH's initiative to enhance reproducibility, rigor, and transparency. As co-chair of the NIH Working Group on Women in Biomedical Careers with NIH Director Dr. Francis Collins, Dr. Clayton also leads NIH's efforts to advance women in science careers. Prior to joining ORWH, Dr. Clayton was the Deputy Clinical Director of the National Eye Institute. In the course of her research on ocular surface disease at NEI, she discovered a novel form of disease associated with premature ovarian insufficiency in young women. This discovery set the stage for her commitment to rigorous, thoughtful exploration of the role of sex and gender in health and disease. Dr. Clayton.
I'm so excited to be here to help celebrate our 30th anniversary, and want to thank WCPI and everyone on board and on the Zoom call and that has worked with us and supported us for so many years. We have an incredible legacy of better science because of you, and that's resulted in better health for women. And we built this women's health research enterprise together. There's so many individuals, organizations, and groups that resulted in ORWH being where we are today. From the women's movement and then the women's health movement, our body ourselves, founders, the Women's Caucus in Congress being founded in 1977, and the scientific community agitating and calling for women to be included. There are lots of folks to thank and that have been involved in getting us to today. There are several that Dr. Cindy Hall has already mentioned, but I will like to add a few additional individuals. It was back in 1993 that Dr. Edward Brandt at the level of the department called for focused attention on women's health issues, forming a PHS task force. And then very early on, Dr. Ruth Kirstein, as you heard, the first woman director of an institute and center at NIH, former acting NIH director and deputy director, was instrumental in setting up the office from the very start. And then, of course, Dr. Bernadine Healy, the first and so far only woman NIH director in 1991, started off the office by recruiting Dr. Vivian Pinn, and the landmark work that Dr. Healy created in terms of identifying the Women's Health Initiative as a critically important activity, and women's heart disease as an aspect of heart disease cannot go without being mentioned. And of course, Dr. Pinn has been our first full-time director, and you look forward to hearing more from her in a moment. In this second chapter, it's really important for me to share some of the advances. I can't share them all because there are so many. But the Women's Health Initiative back in 1991 and then 1993 represented a substantive change in how we look at the health of midlife women. It helped answer questions that we thought we knew the answers to, but because we hadn't studied them rigorously, we actually didn't. One of the largest ever disease prevention and clinical studies focused on the health of women. It's still ongoing, still contributing to knowledge about cardiovascular disease and aging in women. And listen to this, it has inspired rapid changes in medical practice, offering benefits 143 times the cost of the original research. That's what you call return on investment. And one of the benefits of the WHI has been a continuous decline in deaths from breast cancer in the United States. Now that we understand how menopausal hormone therapy works and its implications, we can better advise our patients appropriately and have decreased the number of women dying from breast cancer. NIH investments also identified the first ever gene associated with inherited breast and ovarian cancer. The HPV vaccine, or human papillomavirus vaccine, is the first ever vaccine that actually can prevent a cancer. 70% of cervical cancers are caused by the HPV vaccine, HPV types 16 and 18. And so over 92% of cervical cancer can be prevented because of a vaccine. The National Cancer Institute led the discoveries and the development of this vaccine, and ORWH has been privileged and honored to be part of that from the very beginning, and we continue to support that work. We want to make sure that we know whether actually a single dose of this vaccine can be protective, and so that work is ongoing. And here's a really kind of high-tech advance for you called EVATAR. EVATAR is a female reproductive system on a chip. It's funded by the National Center for Advancing Translational Sciences, or NCATS, one of the newest institutes and centers at NIH, and a miniaturized version, 3D version of the female reproductive tract and the liver is on this chip. And so we can test medications in terms of looking for efficacy in terms of treating reproductive diseases, as well as looking for toxicity concerns. And we're currently studying modeling PCOS, polycystic ovarian syndrome, a highly prevalent condition, and testing candidate medications using this high-tech intervention and diagnostic strategy. As you heard from Cindy Hall, inclusion or the lack of inclusion of women in clinical research has been part of ORWH from the beginning and was the impetus for forming the office. So we like to say inclusion is in our DNA. And from the very beginning, in 1993, the Revitalization Act required researchers that are supported by NIH to include women. And now I want to fast forward to share with you that over 50% of the participants of NIH-funded research are women, and that as a result of the 21st Century Cures Act, we have even more advances in this space. We now include individuals of all ages in NIH-supported research, from the youngest to the oldest old. So we are looking at both sex, gender, race, ethnicity, and age as important determinants of health outcomes. And as well, the NIH now requires that applicable phase 3 clinical trials report their results disaggregated by sex, gender, race, and ethnicity into the website clinicaltrials.gov, representing an important advance in getting the results of studies into the hands of the public. From the beginning, ORWH has considered a life course perspective in all that we do. We know that the health of women is determined in many cases from things that happen during childhood or puberty or adolescence. And without considering that life course perspective, we miss important aspects of the story. The health of women is determined both by internal biological factors, sex being a primary consideration, as well as external factors. So gender, social determinants of health where we work, live, play, behaviors that we take on that either promote or detract from our health, the environment that we live in, or toxic exposures, and of course policies all affect our health. And these factors are intersecting and interacting with each other all along the way. Without considering all of them, we are unable to really address some of the toughest problems that face us today. And so we continue to promote a multidimensional framework and a life course perspective. As I move into chapter 3 of ORWH's story, again, very just the high level to share with you today, it's important to share that Dr. Collins, the NIH director, and I put out a piece in Nature talking about our intention to address the fact that while women were being included in our clinical studies, we didn't see both male and female animals being studied consistently in our preclinical studies. So to put science to work for the health of women, we have announced our intention to develop policies, practices, and programs to meet that need. And in 2016, the NIH Sex as a Biological Variable, or SABV for short, policy went into effect. The policy states, in short, that NIH expects that investigators will account for sex, being male or female, as a biological variable in their research designs, analyses, and reporting for vertebrate, animal, and human studies. And that went into effect in 2016. Because of SABV, that will inform the design of clinical trials so that we can understand better if treatments work in men and women. That in turn informs sex and gender appropriate medical care for all of us so that each of us receives individualized recommendations and fosters a system-based understanding across the board of the influences of sex and gender on health and disease. And how we've implemented that and applied that across ORWH signature programs, is highlighted here. I'm just going to give you a couple of details from the amazing programs that have been developed over the 30 years at ORWH. The BIRCH program, Building Interdisciplinary Research Careers in Women's Health, is our mentored career development program designed to increase the cadre of women's health researchers. We have supported to date over 700 men and women women's health researchers across the country. Our specialized centers of research excellence on sex differences are NIH's only disease-agnostic sex differences research centers and continue to support sex differences research that's relevant to the health of women. And several years ago, we started a sex and gender administrative supplement program with virtually every institute and center participating over the last 5 to 6 years, where we supplement NIH grantees from all of those different institutes to look at both males and females or increase the numbers of men and women in their ongoing research, bringing a sex and gender lens to that ongoing landmark work, funding the top of the top and getting them to advance sex and gender. And just this year, we're funding our first ever R01, NIH's bread and butter grant on the intersection of sex and gender influences on health and disease. It's also NIH's first ever R01 on sex and gender. So we're really excited and working with almost half of the institutes and centers on that and hope to expand that in the future. There are challenges to the health of women. The story is not completely rosy, and in fact, we do know in our country a disturbing rate of maternal mortality exists, and we want to put together resources and investigations to be able to address that. And this year, NIH has really stepped up in that regard. I'm pleased to share with you a trans NIH maternal mortality task force that I have the privilege of co-chairing with the NICHD director, Dr. Diana Bianchi, and the NIH Associate Deputy Director, Dr. Tara Schwetz, where we're poised to announce funding of some programs and grants this year, so stay tuned for more. We also partnered with the National Institute of General Medical Sciences, ORWH, and NIGMS, created a women's health research program leveraging the ongoing Institutional Development Award States, or IDEA States program. These are in 25 states across the country that get the least amount of NIH funding and are often in rural settings where they're underserved populations. We've added women's health, maternal mortality, and infant morbidity and mortality to that program just this year. And I'm really pleased to be able to support the National Institute of Minority Health and Health Disparities first R01 on addressing racial disparities in maternal mortality and morbidity, along with NIMHD and other institutes and centers. ORWH created 3 years ago a program on understudied, underreported, and underrepresented populations of women. We call that U3 populations, and we've funded now over 50 awards, several of them focused on maternal health, whether it's insulin resistance in pregnancy, sickle cell disease in pregnancy, a huge issue in the African American communities, the growth of fibroids during pregnancy. Those are just some of the topics that constitute part of NIH's robust response to maternal health disparities. To make sure that everyone has the tools and resources that they need to incorporate sex and gender into their work, we have created a variety of online modules following up with the longstanding commitment of ORWH to e-learning. Soon we'll be posting our Sex as a Biological Variable primer that highlights how investigators at all levels can apply the SABV policy to their ongoing research. We have an introductory course to scientific basis of sex and gender related differences, and we've again partnered with the FDA's Office of Women's Health to release a bench to bedside module integrating sex and gender to improve human health, designed for health professions of all kinds. And here are some of the topics that are addressed there, and we will be adding more in the near future. As NIH addresses the COVID-19 pandemic, we organized ourselves to create a trans-NIH strategic plan to guide NIH research in this space. And I'm absolutely pleased to share with you that it includes a separate priority, priority 5, on preventing and redressing poor COVID-19 outcomes, in particular addressing health disparity and COVID vulnerable populations. Pregnant and lactating women are included in COVID-19 vulnerable populations and have been included in specific funding opportunity announcements that NIH has released this year. So I encourage you to take a look at the NIH COVID website for more details. As I come up on this last chapter, we can't do any of this amazing work without a robust, diverse research workforce. You know, that part of our mission has always been to develop opportunities and support for the recruitment, retention, reentry, and sustained advancement of all women in biomedical careers. And we imagine a world where every woman can reach her full potential. Some of the pivotal events in this space for us have been the development of the Birch, as I mentioned, 20 years of that. The early funding, along with others, of the National Academy of Science, Engineering, and Medicine Beyond Bias and Barriers report, the consequent formation of the NIH Working Group on Women in Biomedical Careers to address those recommendations, some of which involved the creation of family-friendly policies that support scientists, and the funding of NIH's first ever Causal Factors and Interventions RFA that supported studies of interventions focused specifically on advancing women in biomedical careers. We also have created an award-winning Women of Color Research Network on the LinkedIn platform, and just this past year supported, along with the National Science Foundation and the L'Oreal Foundation, a National Academy study that resulted in the National Academy's report, Promising Practices for Addressing the Underrepresentation of Women in Science, Engineering, and Medicine, which contains specific information for how we can scale up what works, and particular attention to the continued need to focus on women of color as a specific area of focus. Dr. Collins also famously this past year announced that he would not be speaking on panels that were manels, or all men speaking, and would be looking at the diversity of the speakers on programs to which he's invited, and would be considering that. He further challenged other NIH leaders to do the same. Why is this important? This pipeline, you know, is not our favorite analogy, the leaky pipeline, because we really don't think of it this way, but it does highlight in sharp relief men and women, men in blue, women in red here, at that terminal degree level where over 20 years from now, for over 20 years, women have received over 50% of the life sciences PhDs, and now for the last 2 years have been 50% of medical students. So at that front, we see lots of women coming in. But when you go from that postdoc residency to that first tenured or faculty position, we see a sharp reduction, and then going to full professor, a continued reduction. And I have to say, underrepresented women in medicine at the faculty level is in particular a challenge. There were 12% in 2009 and 13% in 2018, and most at the earliest stages. So that continues to be a place we need to focus our attention. But NIH recognized that based on data, women were leaving this pipeline in that transition from their K award, postdoc, and early faculty to that first faculty position. And then once they got their first R01, women did not come in for a second R01 at the same rate as men did. And so we developed what we were calling continuity supplements for K awardees and RPG, first R01 and R01 equivalent recipients. These funds and time allow investigators who experience a qualifying life event, like childbirth, adoption, the illness in a family member, or themselves, to be able to have supplemented time and money to be able to stay on that track to advance through to their full potential. I'm also thrilled to share with you that we also established, through working with the Working Group on Women in Biomedical Careers, the first ever NIH Challenge Prize for enhancing faculty gender diversity. We will be recognizing institutions, organizations who have done a good job at advancing gender diversity, talking about how they did it, and importantly, sharing those lessons learned broadly across the board. So stay tuned for more. As I end here, it's critically important, I think, that we all recognize the pandemic is about infection and illness, but it is also about more than that. It is having a profound impact on the biomedical careers of scientists, in particular women. Women represent over 70% of healthcare workers, and as such have increased exposure on the front lines. This pandemic runs the risk of eroding the progress that so many of you on this call have fought for and have made towards gender equity. It's exacerbating challenges that many women scientists already faced before the pandemic, especially among principal primary caregivers who are trying to navigate working from home when they can work from home, homeschooling their children on 4 different Zoom platforms, caregiving, and everything else that we're doing. And many bench scientists just can't do their work from home, so they aren't even able to advance their work and run the risk of stalled progress. What we've seen, the data show there's an increase in the gender gap in publication that existed before COVID. Women first authorship and corresponding authorship has dropped. There are fewer women putting in preprints, and fewer women are being asked to comment on the COVID-19 pandemic in the media and in other spaces. We know if there's a reduction in publication, that has productivity consequences. That's what leads to you being invited to speak in other venues and is considered for promotion and tenure. This is even more devastating for women of color and for early stage investigators. So we are rolling up our sleeves to think about what we can do to ensure that we don't lose this really important generation of biomedical researchers who are going to find the solution for COVID and many of the other challenges that we face. As I end, I highlight for you the Women's Health in Focus quarterly publication that we produce. This year, we have 4 issues focused on our major mission areas. The next one coming up very soon is on inclusion. You can sign up to receive these at the website indicated below. You can follow us on social media, and you should sign up to receive our ORWH's monthly email called The Pulse.
I am now pleased to introduce Congresswoman Brenda Lawrence, co-chair of the Congressional Caucus for Women's Issues. Congresswoman Lawrence is serving her 3rd term representing the 14th District of Michigan. She serves on the Appropriations and Oversight and Reform Committees and has been a strong advocate for women's health and closing the health disparities gap, for women of color. Congresswoman Lawrence.
Hello, I just wanted to take the time to say happy anniversary. Thank you for advocating and being present to be a conduit for the voice of women. For us who are given the amazing opportunity, now over 100 of us strong in Congress. As we look at the history of women this year, we celebrate the 100th year that we even got the right to vote. And now we have over 100 women in Congress. I want you all to know that our voice is needed. It's not just a nice thing. We are over 50% of the population. Policy, economics, health, education, everything that we do, home ownership, employment, we the population. And in many areas still today, we have a lot of underrepresentation. We have before us quite the struggle. And as we mourn the passing of the amazing, notorious RBG and saw how she stood up and fought for the voice of women, for the rights of women, I'm telling everyone that while our heart is broken and you know we're mourning, she passed the gavel to this next generation to make sure that our voices and our rights are protected. To stay, you know, we use sometimes the phrase stay woke. It means stay informed, get involved, and know that what we do helps and improves the lives of the next generation. Had those women not protested and worked hard 100 years ago, would we even be sitting here today with the rights and the freedoms that we currently have? I want everyone to enjoy this celebration of our anniversary. I want to thank the leadership of WPI who has been such supporters and just steadfast in their efforts to give internships, to engage in policy discussions so that we can do our work. So everyone be safe. I look forward when I can see you all in person, and have a great day. And happy anniversary.
Thank you so much, Congresswoman Lawrence. It's always a pleasure to have you speak at any event, and we so appreciate all your leadership across women's issues. Thank you for joining us, and I know this is a difficult day particularly. So Dr. Clayton, I will turn it back to you.
Thank you, Cindy. It's now my pleasure to introduce our next speaker, my predecessor, my mentor, and my friend. Dr. Vivian Pinn is a woman of many firsts. As I pointed out, she's the first full-time director of ORWH and served us at NIH for 20 years, and was the first permanent NIH Associate Director for Research on Women's Health. She was the first African-American woman to lead a U.S. pathology department at the Howard University Hospital. No doubt that besides being a physician and her multiple accomplishments, which I don't have time to delineate today, she's a physician, a researcher, an advocate, and leader, but most of all, Dr. Pinn is a pioneer. Through her NIH career, she's been dedicated to enhancing women's health research across NIH and through the entire research enterprise. She's fond of saying that all women are not the same, women and men are not the same, and that we need to consider the effects of race, ethnicity, as well as other factors on health so that we can ensure the benefits of science reach everyone. She led many of the NIH early efforts to implement the inclusion policy that you heard about and to promote the importance of sex differences across the research spectrum, co-chairing the very first NIH Working Group on Women in Biomedical Careers with the then NIH Director, Dr. Elias Zerhouni. And as a result of her efforts, that landmark causal factors and intervention funding opportunity was launched. That is the most ambitious NIH research effort to date on advancing women in science. For her countless contributions, mentorship, and service, NIH established the Vivian Pinn Symposium, an annual event that takes place every May during National Women's Health Week, and I invite you all to join us and attend in 2021. It is so fitting that Dr. Pinn, a woman who has spent most of her life working to improve the health of women, would share her unique perspective with us today in our celebration. Ladies and gentlemen, Dr. Vivian Pinn.
Thank you, Dr. Clayton. That was quite an introduction. And actually, I want to thank you for all that you have already given to those of us participating today in the 30th anniversary celebration to show what this office has done, is continuing to do, and our hope for the future. This is really a wonderful event for those of us who have been part of the ORWH, and I hope for all of you who have followed and worked with us in the Office of Research on Women's Health. To think back to when this office first started, that today it's been 30 years. I mean, that is just unbelievable. And actually on the call today, there are at least 4 of us who were in that original office. Judy LaRosa, who actually preceded me with Dr. Ruth Kirstein setting up the office and served as the first deputy director of that office, and really helped me gain my footing at the NIH, and then several others, Joyce Rudick and Terry Kendricks. But I think when we started, we really had the mission statement as a policy office to ensure the inclusion of women in clinical research studies funded by the NIH. And as you can see, we have expanded far beyond that. And we have to thank the members of the Women's Caucus who saw to it that we actually, as a policy office, first got our budget. And once we got a budget, we could help to influence funding of research. And it has just grown and expanded since then. And I have to give credit to Dr. Healy, who obviously was the NIH director when we really got the office going, who said, go for it. I said, can we do this? Can we do that? She said, go for it. And she allowed us to just expand our ideas. And that passion that she had and that we all shared and that you all shared with us helped us to really expand into the many venues and many programs and initiatives that have come about since then under the aegis of the ORWH. And so, and fortunately with the business, with the inclusion, when we first started trying to put forward that concept of inclusion of women and minorities in clinical studies, fortunately the NIH Revitalization Act gave us the teeth we needed to be able to really implement that policy with some backbone. And that, of course, has led to changes in the design of clinical research studies beginning in 1990 and with the reauthorization bill in 1993, so that today it is pretty much accepted that, and it should be universally accepted, that women and diversity of participants in clinical research studies are expected to be there, and investigators expected to adhere to those policies and those concepts. And I think we're hearing a bit about that now as we hear discussions about the vaccine trials. At least referrals back to this policy for inclusion has existed since the early 1990s. But I will not try to reiterate everything that's been done, except to say, I think many of us are just as passionate. I hope all of you are just as passionate as we were in the beginning of this office, and recognize that even though we've made a lot of progress, there's a lot more that's needed to be done. Dr. Clayton has laid out for you some of the initiatives going forward now. We need to continue to support that office, and to support its initiatives, and to support the concept that women's health is important. What is the biggest change I've seen since 1990? Well, back when we first started, we had to convince people that there was such a thing as women's health and why it was important. Today, we just talk about what needs to be done to further our knowledge about women's health. So I want to end my brief remarks by, first of all, thanking the Women's Congressional Policy Institute, and especially Cindy Hall and her staff, for bringing about this acknowledgement and celebration that for us, the original and present members who are associated with women's health can really enjoy. And we appreciate your giving us this opportunity to acknowledge this office and what it has done. We really want to acknowledge and thank the members of the Congressional Caucus on Women's Issues, those who were there at the beginning and those who are presently involved, for really, you can consider women's health research your legacy, one of your major legacies. At least I think it's a major legacy with my interest in health. And also that you really helped bring back in the early 90s a recognition in the national consciousness of women's health and the importance of research, not just what we know about women's health, but the importance of research in helping us to expand our knowledge about and how to improve healthcare for women. And also, I just want to say that I think the passion we had when this journey first started still didn't lead us to really not think about where this directive could go, where these initiatives could go, and what the ORWH and the NIH and our advocates and our supporters and the scientific and medical community could really go. And what you've heard today from Dr. Clayton is that I think it has even surpassed what I, in my wildest dreams, hoped we could do. So a final word of appreciation to our advocates, because I was always guided in what we did by not just our scientific and medical community, but by our advocates who really kept us on the straight line and letting us know what was needed by women in the community for their health and their well-being. And many of you know how important you were in guiding this office in its early days and supporting what we do today. This has been a dream that many of us had, that the Women's Caucus initially gave us the opportunity to develop. And I'm just delighted with where we are and beg for your continued support for Dr. Clayton, the ORWH, and the NIH so that these efforts can continue. And now I want to just mention that, as we've heard before, there are going to be some remarks from some of the key former women and current senators and members who worked so hard to establish ORWH that 30 years ago, and who have continued over the years to acknowledge this office and its funding over the past several decades. We're so grateful to many more congressional champions that can't be included in this brief program, but I want to thank all who have helped to make this possible. And then let's turn to some of the quotes from some of the champions we've had over the years. From former Representative Pat Schroeder, "I'll never forget the shock of reading the investigation results of the NIH study that Olympia Snowe and I requested," she said. "Really, no women were included in any medical studies, including breast cancer and aging. Not only that, NIH did not even use female rats. We were beyond motivated to change that," which she did. And now 30 years later, the goal of knowing as much about women's health as men's gets closer every year. Power on, in Pat Schroeder's words. From a former Senator, Olympia Snowe, "The creation of the NIH Office of Research on Women's Health was a watershed moment that brought gender equity to medical science, and it is an honor to pay tribute to their groundbreaking achievements. As we celebrate the 30th anniversary of this landmark initiative, I could not be more proud of the extraordinary progress the office has made to driving life-saving advancements in women's health in America. I look forward to following its future successes as it continues to blaze trails benefiting the well-being of women for generations to come." And then from former Senator Barbara Mikulski, "I could not be prouder of all the Office of Research on Women's Health has done for women's health, and I am honored to be part of its foundational history. 30 years ago, women did not have much to celebrate when it came to scientific advances. We weren't even at the table. We were systematically excluded from clinical trials and ultimately ignored in medical textbooks. Today's researchers, many of them women, look at disease in a gender-specific way. We've made great strides in life-saving treatments and cures for women and girls across America and around the world. What a thrill to celebrate the 30th anniversary of the ORWH at NIH, and what a privilege to have been a foremother in the creation of the office, and she has been dedicated to us all these years. At that time, our bipartisan, bicameral foursome learned of the admission of women in clinical trials and protocols. Women were treated as little men with no recognition of differences and consequences. Even the research animals, like rats, were only males. The office, established in 1990, has made all the difference. Let's continue." And now we're going to pull up some videos to hear from a few other Congresswomen who want to make comments.
"Only wish we could be together in person to celebrate 30 years of the Office of Research on Women's Health. I remember when we learned that the NIH was, for the most part, ignoring women in clinical and preclinical trials. As we later learned, even the lab rats were all male. And that's why the work of the Office of Research on Women's Health is so important. By ensuring that the NIH-supported research addresses women's health, we can gain a better understanding of how diseases and conditions affect women and give more women a chance at a longer, healthier life. We've come a long way, but the fight for gender equity in medical research must continue. Thank you, and here's to another 30 years.
Hello, this is Congresswoman Rosa DeLauro. I'm thrilled to join you in celebrating the 30th anniversary of the National Institutes of Health Office of Research on Women's Health. I was first elected to the Congress 30 years ago, and I worked with my fellow female lawmakers on both sides of the aisle to create the NIH Office of Research on Women's Health. In the early days of time in Congress, it remains one of my greatest accomplishments. In your 30 years, you have changed the way we think about women's health, and in turn have changed the lives of thousands of women across our country. Your work has helped close the gap between men's and women's health research. And as you know, there is still more work left to be done. As chair of the Appropriations Subcommittee that funds the National Institutes of Health, I was proud to help secure an additional $2.6 billion increase from last year over the fiscal year 2019 level to support the critical research you do. The lives of women across the country have been strengthened and extended because of your courageous efforts. And for that, you have my unrelenting support and my gratitude. Thank you. Thank you for 30 years of lifting up women through research. And I look forward to working with each of you again soon.
Hi, I'm Congresswoman Debbie Dingell from Michigan, and I can't tell you how happy I am to be here today to talk about the importance of women's health research. I first became involved in public service because of the need for that. When my college roommate became sick, had a cardiac problem, and I found out that women weren't included in any federally funded research because we had hormones. Well, we're more than 50% of the population, and we needed to be part of that research. And we successfully fought to have women included in federally funded research. And thanks to Dr. Bernadine Healy, she formed this advisory group, and you've been making a difference ever since. When women have the answers to important health questions and they're informed, they're in charge of the health, and we get better outcomes. Research and information are critical. Congratulations on 30 years, and here's to many more. And I promise you, there are a lot of us that'll never stop fighting for the critical work that you all do.
Thank you, Dr. Penn and Cindy, for putting the finishing touches on this wonderful celebration of ORWH's 30th anniversary. Since 1990, a lot of water has flowed under the bridge. We've seen dramatic improvements in some areas of women's health and steady continual progress in others. Sadly, in other areas, such as maternal health and the opioid crisis, conditions continue to demand our vigilance. And we realize that the health crises of today are going to require even more of us in the future to keep focused on the health of women. And we are up to the challenge. We're all in this together. All in all, though, the record of ORWH is clear. Its leadership in and outside NIH has contributed to the arc of science, moving forward towards longer and healthier women's lives. So I'd like to close with appreciation for where we are and how we got here. My first thank you has to be to our friends on Capitol Hill, especially the Women's Caucus, who got this all started with a vision for a focal point for women's health research at NIH. Over the years, so many members have spoken up for women's health, and we look forward to even stronger partnerships in the future. All women deserve healthy lives and to reach their full potential, and our work is not done until we realize that vision for every single woman in the country. Thank you to Dr. Robb, Dr. Healy, Dr. Kirstein, and all of the early supporters across HHS NIH who paved the way. Thank you, Dr. Penn, current and former NIH and Institute Center leadership, and our many institute and center partners who collaborate to implement ORWH's programs. Thank you to current and former advisory committee members and current and former ORWH staff. And special thank you to all of the women's health advocacy groups who have supported ORWH through the years. We are still counting on you. Thanks to all the women's health and sex differences researchers and physicians who have tirelessly advocated for considering the health of women in the lab and in the clinic, many of whom went the extra mile in supporting development of NIH strategic plans for women's health research. Finally, a very special thank you to Women's Congressional Policy Institute for your dedication, for your support, for your perseverance. Thank you for organizing today's lovely celebration. Your leadership in women's health issues has made a real difference in the lives of so many people. It has helped make America a healthier nation for everyone. I'll turn it over to Cindy Hall to close us out.
I want to thank Drs. Clayton and Penn for their many years of work on behalf of women's health and for leading the Office of Research on Women's Health through these 30 years. Each of you have contributed so much, and we are grateful. We also thank the current and former senators and members, both women and men, who worked so hard on behalf of ORWH, and many of you in the audience who were advocates for the office over the past 30 years. Our thanks also to our congressional co-sponsors and staff. And finally, my thanks to the ORWH staff, particularly Jamie White, and the WCPI team, including Cynthia Ramos, Cheryl Williams, and Julia O'Connor for their work to make this event possible. Thank you so much for joining us. And here's to another 30 years.